I'm talking to Kelvin now about ultrasound use in primary care. Kelvin, you've done a talk to everyone about the possibility of using ultrasound and how you could be using it, what we might be able to do with it, and what your recommendations are. Can you tell us a little bit about the basis of your talk?
Sure. Well, my talk was titled Ultrasound to Mitigate Uncertainty in Primary Care Clinical Diagnosis. And so the idea was that we can use ultrasound to increase our certainty of our differential diagnosis when we're assessing patients in primary care.
Yeah, you were talking before about how we should be using it to help us, as you say, in increasing our diagnosis certainty. In what ways have you used that in your practice, and in what ways has it helped you?
Sure. Well, the idea behind point of care ultrasound is that you answer specific binary questions. So you may have a patient with back pain and you want to exclude a AAA. So your question would be, do they have an abdominal aortic aneurysm? And you can use ultrasound to give a relatively rapid answer to that question.
Yeah. And are there other situations that you found it more useful than you thought you would?
Sure. Yeah. Initially, when I did my training, I thought that I would be using it for things like gallbladders and maybe some a DVT presentation or some musculoskeletal. But I found that the most frequently used applications have actually been above the diaphragm. And pneumonia is a big application, and something that people think that ultrasound can't be used for is imaging the lungs, which it's actually very good at, and an echo looking at the heart and identifying whether somebody has cardiac failure or pericardial effusion in certain circumstances is really very helpful.
So it's using it in conjunction with, so we still have to examine the patient,
still have to do your
listen to the
examination.
lungs and the heart, but using it in conjunction with that to either define your diagnosis better or to try and help you come to a conclusion about someone.
That's right.
Why do you think we should be using this? You know, obviously it's really going to be helpful in certain aspects. Why do you think we should be using it every day?
Well, most of our diagnoses are through our history, which we know, and examination adds a little bit to that, and it risk stratifies, it raises our pretest probability, but it's still a relatively insensitive tool. And ultrasound allows you to get definitive answers if you have specific questions, and so it really increases the sensitivity of being able to detect pathology when you don't have access to other imaging or other tests in a primary care setting.
And it's relatively quick.
It's quick. Once you get up to speed in terms of your training, you can answer one of those questions in a couple of minutes. It really doesn't add a lot of time, and especially if you have a machine in your consultation room, it just becomes part of your physical assessment.
And do you find that next step, so if you do find something you either weren't expecting to find or have clarified that there's someone that needs to be referred or the next step that needs to be taken, have you found that a really useful tool to add into your referral process?
It's the understanding of the use of ultrasound is variable amongst different specialties. In the emergency department, they're very familiar with it. So if I make a diagnosis and I'm sending them to the emergency department, they're very happy to accept that. Some other specialties are surprised that you're using ultrasound in the community, and some sort of less excited. But it certainly is helpful to be able to disposition the patient more accurately and send them to the right service.
How easy is it to learn? Because I guess there'll be people out there thinking, oh, this might be a really useful thing for my practice. How do they go about learning, and how quick or easy, and how often do they have to keep up with the training?
Each individual application is relatively easy to learn, and there have been a lot of studies which have shown with novice users, with medical students, that they can learn the techniques and acquiring the image and interpreting the image accurately within a relatively short space of time. A day's training, for example. It takes a little bit more time to understand the full scope and to acquire the different technical skills for the different applications, but it's not difficult, but it takes it takes a bit of time.
Yeah, so for those who might have a special interest, or for those practices that think they might need to add something to help them with their patients, is a different modality to use.
Yeah. And it also adds a real a neat dimension to clinical practice, because it allows you to see inside the patient, and it allows you to show the patient what's inside them. And rather than detracting from the physical examination or interaction, it actually adds to it.
That's right. Have you found patients very receptive to it?
Yeah, they love it. They love the fact that they can have an answer more rapidly, and it sometimes allows you to avoid other investigations like a chest X-ray, for example, that you would have ordered otherwise.
Yeah, yes, absolutely. Any other key messages that you think people should take home? It sounds like it's something they should definitely be considering regardless.
I think that with the reducing cost of ultrasound machines over the next couple of years, it's going to become more and more commonplace.
Yes.
And that even medical students overseas are starting to use ultrasound as part of their physical examination or physical assessment of patients. And so it's something that it's the future, but it's happening now. And I think in 10 years' time, every specialty will be using ultrasound in some way or another at the point of care.
Thank you, Kelvin. That's been really interesting. I appreciate it.
Thanks for having me.